So, David,
Great.
all yours.
Thank you, Scott. And hi, everybody. As Scott mentioned, I'll talk a little bit tonight about a topic, and then you can ask questions about that topic or about anything you'd like. Um, what I want to talk about tonight is self-care. I think it's really important, always in recovery and sometimes challenging. But I think it requires a real mind shift, because I think sometimes when we're in active addiction, drugs, alcohol, sex, porn, whatever our addiction is, becomes our kind of main priority. It really takes over our lives. As some people say, and I think it's probably essentially true, that becomes our primary relationship. That's the relationship that we protect and guard against all odds. So it's important once we get into recovery to really figure out, okay, how do I take care of myself? And it's easy in recovery to get caught up in daily life, and because we have to manage meetings and the chaos our addiction has caused, and often therapy and getting to meetings and patching up relationships and doing all kinds of things. So taking care of ourselves sounds easy, but I think it can be quite important. One struggle people have, just before I want to do 5 tips for self-care tonight, but one struggle people have, I think, is that it kind of feels selfish. That it's taking time for themselves, it's time away that they really need to be devoting back to their families and their jobs and all that. And I think, of course, that's necessary as well, but it's really important to build some of these self-care tips or practices that I'm going to talk about tonight into your daily life, because without that, we really start to kind of spin out, and the risk of relapse actually increases. So, taking care of ourselves is not selfish. By taking care of ourselves, I mean compassion for myself, patience with myself, with other people, even love for myself, trying to reverse some of that shame and low self-worth that is really typical of almost every addict I've ever worked with or known, myself included. So 5 tips tonight just to talk about, and I'm probably talked about them all before, but these are my go-to points for sure. One is to stay mindful. I think if we can sort of be conscious as we go through our day, we start to learn a whole bunch of things. First of all, we start to notice. We wake up, but we notice patterns, we notice trends, we start to connect a physical sensation with a feeling, we start to connect certain people or places or things with certain triggers or cues or feeling good or feeling bad. And just we start to notice all these patterns if we're mindfulness. And just I define mindfulness as just the simple practice of being aware not only of what I'm thinking and feeling, what's going on internally, what's going on externally, and to be aware of it without judgment. Not judging myself to say, boy, that's a stupid thought, or why are you still worried about that, or all that critical self-talk that is always going off in our ears. But I think it's really important to kind of just tune that out and just be right in the present moment, in the present tense. And I like to get up and go out. If I get kind of bogged down writing or doing too many hours of therapy or something, I try to go outside and take like a 15-minute mindfulness walk and just, walk. I live near water and really pretty areas, and just go out and notice the trees, notice the water, notice the colors, notice the sky. Do I hear birds? Do I hear boats? What's going on in my life? And it shifts gears somehow and just kind of brings me back into the present moment. Or you could do mindfulness just at home. I like to do mindfulness. I like to cook. That's one thing I've discovered in recovery, and especially in the pandemic. It's been a lot of cooking, a lot of eating too. But what I've done is really, I try to be mindful when I'm cooking, just really be present, whether I'm chopping or sauteing or measuring or whatever, just really be present and there for myself. And it's a really lovely kind of meditative exercise. So that's being mindful, practicing mindfulness. The second one is connecting with other people in recovery. That in definition, even by definition, even in recovery, we are much more prone to anxiety disorders, depressive disorders, other kind of mental health conditions. And all of those really thrive with isolation and solitude. And so it's critically important to get out and break those that wall that we have around us and really start to connect with other people in recovery, because that is where the healing takes place. We can't do it on our own. If we could, we would have, most of us would have, but we need to really find other people and get that balance, allow other people to be the mirrors of what's going on with us, other people to reflect back to us what they see, do some reality testing sometimes to just check and see what's going on with ourselves, run it by somebody else. But mostly it's the healing force of being connected. You know, if I go to a meeting, in the old days, I guess I haven't been to a live meeting in a while, but you know, even online, you go and I feel connected. I feel like I belong. And I think that sense of belonging is really critical for me to ground myself and kind of be at ease and at peace. Otherwise, I can kind of get disconnected from my grounding and kind of start to spin and fly around with anxiety or stress or worry or checklists of things to do and all that kind of craziness. So it's really grounding, I think, for us to connect with other people in recovery. Third one, and this is the one I still struggle with. I keep reading those promises, but I still struggle with finding balance in my life. I think, you know, generally, I think many of us are wired with these societal expectations that where we get value by doing, right? How much we accomplish, what can we achieve, what can we do, how much can we do? And I think a lot of recovery for me has been learning how to not just do, but how to be, how to just be, how to be in my own skin, how to relax, how to live with empty space, with which can be triggering at first, but to really sit and have a nice relaxing time. Just read a book or just do some simple pleasure. That kind of stuff gives me balance. And I think we really have to have that balance to between all these pieces of our lives, right? We have a lot of demands on ourselves with work and school and parenting and relationships and all kinds of things, plus meetings. It all can kind of get really overwhelming sometimes. And I think really finding balance between that. And that for me includes saying no. I think by definition, I'm kind of a people pleaser. So if somebody asks me to do something or get involved with something, I almost automatically say yes. And I quickly get overwhelmed then and just I get out of balance. So balance is a struggle for me still, but I know it's probably the key to a really strong recovery and peace of mind. Uh, Two more, then we'll go to the questions. The fourth one I have is taking time for yourself, right? While connecting with other people is important, we also have to find that balance between being by ourselves. Like a lot of us really had to learn how to be comfortable with spending time with ourselves. And I think that's incredibly important for growth, for reflection, for just kind of letting the process happen, the recovery process. You know, I think there's a difference between being alone and lonely. And I didn't know that distinction when I was early in recovery, but I think I value now some alone time. Not always, not too much, but I think it's really important to kind of cut down all the noise from the outside world and just kind of be with myself, with my thoughts. I do a meditative practice every morning. It's a nice way to kind of gather my thoughts and my feelings and get ready for the day. And then finally, the fifth one, I think is important for self-care, healthy boundaries, right? We've talked about boundaries before, but it's about really protecting ourselves and our sobriety. You know, boundaries are about us. They're about how much of ourselves we give out, but also how much of other people we let in, and we have control of that. And I think a lot of those boundary issues that many people in recovery have, at least at first, are ways we've learned, you know, from dysfunctional families or from just not having good boundaries in general, feeling unworthy and wanting to go above and beyond, or feel like we have to work harder to earn someone's love or respect. All that starts to affect our boundaries. So I think it's important. And the other hard piece in early recovery, I think, is that sometimes the people we have, the associations we have, were built to help our addiction go forward. There are oftentimes people that acted out like we do, that drink or drug like we do, because they enable us. I personally always found people who were deeper into their addiction than I was because I could feel better about myself comparing myself to them. So basically, I had to kind of find new friends when I got into recovery, and that's a boundary too, to sort of, and that's hard sometimes to kind of put a boundary between myself and people that aren't good for my recovery, but also understanding there's lots of opportunity to meet new people when we go forward in recovery. So boundaries and learning how to do them and manage them are the kind of the fifth really important step, I think. So I think that's enough from me. Thank you.
Thank you, David. I think self-care must be the topic of the day because I facilitated our our discussion group for professionals who are in recovery, so that they can come in and talk sort of openly about their struggles. And we spent the whole hour talking about self-care, and we pretty much hit everything you just covered. But we spent a lot of time on it's not selfish to take care of yourself. And what we all agreed was, when we're an addict, we feel like we don't deserve to have any fun or to do things that are good for us. We feel like we should spend all our time focused on recovery and healing our relationships. And, we forget to take care of ourselves. And part of taking care of ourselves is having a little fun in life, So,
Right.
Great topic. I have questions, but I'm going to skip them because we have a bunch in the Q&A feature already. So keep them coming, and we'll get to them as quickly as we can today. Is neurofeedback helpful for betrayed spouses? My therapist said my PTSD is too severe for talk therapy to address properly, as my nervous system has been in fight or flight mode for a year. She has recommended neurofeedback to me. By the way, betrayed partners often manifest symptoms of PTSD. Whether they actually have PTSD or not depends on how long it sticks around. But they often manifest the symptoms. So this is not unusual.
Great question. Trauma, and it's true that partners clearly, can have those symptoms of PTSD and experience those traumatic reactions. And so what we found over the years, and we've really gotten good at dealing with trauma the last 15 or 20 years, a lot of new therapies, but we basically know now that trauma, the way it manifests, is much more than just something that can be resolved by talk, by cognitive therapy, because trauma actually is rooted in nonverbal parts of our brain. It's rooted, there's muscle memory, there's nervous memory, and other kinds of reactions that aren't verbal. A lot of trauma actually isn't something that we can talk about and heal. And so the new trauma therapies that have some kind of somatic or physical component recognize that, and they address that. And so I think your therapist is correct in that you can't really expect to resolve trauma, at least to any degree, as it sounds like yours is, with talk therapy. And the talk therapy is incredibly valuable, cognitive behavioral therapy and just sitting in an office and chatting. But to really resolve trauma requires doing some physical work as well. And so there's a lot of traumatic therapies that like EMDR, that incorporates not just a cognitive piece, but a physical piece and some bilateral brain stimulation. And there's brain spotting and somatic experiencing. And there's all kinds of therapies now that really recognize the benefit of not just connecting our ideas and thoughts, but connecting those ideas and thoughts with the physical experience of trauma and how it's kind of manifested and rooted in our body and releasing it. And so even some of the most effective trauma therapies, I think, especially for early trauma, are like things like breath work. They don't involve talk at all. It's just doing a lot of breathing. And so, yeah, definitely. I once heard an expression that you can't solve a left brain problem with right brain therapy, meaning, you can't solve a left brain problem, we can't solve talk problems and things that are really deeply rooted in our bodies, but just by talking about it is what that means. So yeah, definitely. I think he or she is right on track with your therapy.
Come on, there we go. Just so people know, PTSD is a really severe disorder. It can affect you physically and emotionally and mentally. It can really impact your life in negative ways. So anybody who's dealing with PTSD, it's worth doing various forms of trauma therapy, as unpleasant as they can sometimes be to experience. But I think it's worthwhile. The symptoms are significant. These next two questions, I think they go together because they're about treatment. What is the biggest change when men first check into seeking integrity versus when they come out of it? Is their shame reduced? Is their denial generally gone-ish? I love that term, gone-ish. And then the next question here is I think, pretty related. Are there any statistics as to the relationship between age and recovery? For example, if a 30-year-old and a 70-year-old check in to Seeking Integrity, do they have similar odds of improvement? So there's a lot of questions in there, but interesting ones.
Yeah, great questions. So I think the biggest change generally, we're an intensive program, meaning it's 2 to 4 weeks, and recovery is a long process, right? So we are really about pretty fast and in-depth and intense assessing and kind of laying a foundation for some of the work that follows. And so definitely some denial reduction is a big part of what happens. People come in generally in at least some state of denial, sometimes a lot, sometimes not quite as much, but I can't think of an exception where a client hasn't come in and had some kind of major revelations about the impact their behaviors had on people they love, or the extent of their addiction, or the fact that they may admit being a sex and porn addict, but those 7 cocktails they had every night weren't a problem until it was pointed, that kind of thing. So yeah, there's a lot of denial kind of breakthroughs that happen there, and just a lot of awareness and education. Shame also, shame is probably an ongoing challenge for a while, but shame reduction is really important. And I think one of the things that I try to do in my work on the unit is kind of explaining a lot of what's going on with the brain, and that a lot of the symptoms and behaviors people are experiencing are not necessarily due to personality faults, but some of the brain and the brain healing process and things like that, impulse control and lack of it, and all that. So I think there's education that helps the shame reduction. There is the really tremendously powerful healing force of the community, of the group themselves. I think that's where a lot of the healing takes place, is just seeing other people, realizing the impact, seeing yourself reflected in the other men in the group. So I think shame reduction happens there as well. And so I think, every client has their own kind of trajectory and path in treatment. They come into different places. Some have spent 50 years in addiction, some are brand new. So they all kind of have a different pathway. But in general, I think there's a lot of shame reduction. In every case, there's, at least to some degree, a reduction in denial. And more important, I think, than all of that, and although that's significant, is kind of an establishment of some skills for early recovery, because that's what we need people to go out. We are taking away addiction, which is kind of a maladaptive coping mechanism. And unless we kind of teach people some skills to deal with the feelings and the triggers and the complications of life that are going to come up, we're really doing people a disservice. So in addition to the breakthrough of denial and some of the shame reduction, I think there's a whole lot of emphasis on skills and understanding, for example, how we have needs that may not be met and how can we meet them in healthy ways, that kind of thing. So it's very intense. You talk to our clients, and I don't know, you may be our clients. They're long days. So yeah. And then, gone-ish, which I love too. I'm going to use that. I think it's generally gone-ish. Now for age, it's interesting. So, and it depends. There's a lot of individual variability. What we do know, some of the distinctions with age, is that the younger someone is, when they start the recovery process with like sex and porn addiction, the faster their brains tend to heal in terms of the reward circuitry regenerating, kind of coming back to normal. The faster they tend to kind of come back to baseline, meaning where the intensity levels have been set so high by the drugs or the sex or the porn that when you stop acting out, the brain has a period of time when it has to kind of readjust back down to kind of normal levels. And that tends to happen more quickly with younger men or women. And so those differences occur. But generally, I think the trajectory is the same for people. I think it's more the brain healing part that I get concerned about. The other thing too, and just because I deal a lot with methamphetamine users, the older you are, and we're seeing a lot of meth users in their 50s, 60s, 70s, much higher risk for cardiac events. So I do worry about the physical element sometimes with those guys. But yeah, Scott, other thoughts on age distinctions or differences?
Well, I wanted to bring up the fact that there might be some people out there thinking a 70-year-old sex addict, does the equipment even work? When you're 70, how much Viagra do you have to take? And it kind of brings us back to the thought that, sex addiction is not about sex. It's about escape. It's about emotional escape. It's much more about the fantasy than actual sexual activity. So yeah, a 70-year-old can absolutely be an active sex addict. Whether or not he or she is having a lot of sex or not doesn't really matter. It's not the amount of sex you're having, it's how much time you're devoting to it, usually with the fantasy, what we call the trance or the bubble that sort of precedes actual sex. How much more, are you looking at porn for 8 hours before you, masturbate and have an orgasm? Well, it's probably an addiction if you're doing that. Things like that. And it's the same way with alcohol. It's not which kind of booze you're drinking or how much you're drinking. It's what it's doing to your life. So that was my thought on age. I also wanted to ask David, is the group setting such as we have at, say, Seeking Integrity Los Angeles, is that really helpful with breaking through denial? Do addicts help each other break through denial?
Oh, yeah, definitely. I think it's so much easier to see the reality in someone else when we see it. And oftentimes then we can reflect that back to that person and vice versa. So I think, yeah, definitely there's something about the group experience. I think it's natural when we go to meetings to kind of compare. I think I hear that a lot with the sex addiction meetings where somebody might be a porn addict and they walk into a sex addiction meeting and they see somebody who has had legal issues or into some exotic kind of thing that they're not into, and just like, gee, what do I have in common with these people? And it's the same thing if I go to one of my AA meetings and somebody's using a drug that I haven't done. I could easily say, well, I'm not like that. But I think the key is to find, what do we have in common? I think that's the beauty of the group, whether it's a 12-step recovery group or at Seeking Integrity. It's like, why are we all here together, at different ages, and what do we have in common? What can I learn about myself from you, from the other people in the circle? So yeah, I think it's definitely a critical factor.
Yeah, I think almost every addict entering recovery thinks, sure, if David was doing all the things I'm doing, he would be crazy. He would have a problem. He would need treatment. But it's okay for me because, and then we just fill in the blank with some crazy rationale why it's okay for me. And I think hearing everybody doing that all at once is like, oh, I'm just another addict full of crap, basically. And yeah.
And also being in a place where it's safe to confront someone's crap if you see it, and talk about it. And that's how people learn. And in a group setting, because you start to trust people, you're vulnerable, you open up, and you have to kind of take it in. If the group is giving you that feedback, it's harder to rationalize that all these people are crazy. Must be them.
Yeah. Be me too. Okay, I have a pattern of idolizing, sexualizing, and fantasizing about my relationships with teachers, supervisors, and mentors. Basically, anyone who is in some position of power and shows me kindness. I recently started step work with a sponsor, and it has been a huge source of support and healing. But I noticed myself wanting to repeat my old pattern. How do I address these thoughts and desires? I'm afraid I will make my sponsor my higher power and will then have to lose this relationship.
Wow. Yeah, well, you want to be careful about, putting anybody on a pedestal, including your sponsor. I think that's kind of setting them up to fail in a way. I think that's some really rich material for therapy right there. When we talk about those kind of erotic patterns and fantasies, and you have a lot of insight, I think, into looking at kind of what that's about. And I would bet, in my experience, these very specific kind of dynamics and fantasies, like with power and authority and being protected or being shown kindness, have a lot to do with trauma and some kind of traumatic experience and early experiences of maybe finding safety by affiliating with powerful people and having them kind of protect you. And I'm making that up, but these are the kind of patterns that I've seen. And I think to go back and really, in a safe way in therapy, go back and see, well, what is this relationship with authority and power? And I think the lesson there is, you know, the goal, I guess I should say, would be to discover the fact that you actually can protect yourself and be and have kindness for yourself. You're not relying on any external source of that. But I think there's obviously more to that story. But I think a lot of these would be resolved. What I found is that when the trauma therapy is effective and when people kind of heal some of these old dynamics, relationships, whatever you want to call them, a lot of these erotic scripts kind of lose their magic. They don't work anymore. They don't fit. They don't fit who I've become. Since I kind of healed that trauma work, I'm no longer interested in this particular fantasy or kink or whatever, because that was kind of part of my my traumatized self, if you will. And so I think you might find that that shifts some if you do some work on the underlying issues that go with that.
Yeah, just a little tip for 12-step recovery when you're finding a sponsor. If you're straight, get a same-sex sponsor. Takes that out of the picture. If you're gay, get an opposite sex sponsor if you can. And this is true. And don't ever pick anybody that you're attracted to physically, just because you're going to run into these issues. And this goes with AA, NA, you know, gambling, all of the addictions. Find a sponsor that you're very unlikely to have this issue with. Otherwise, you're going to have this issue because it's fairly common, when somebody's kind to you, to have feelings for them. So yeah.
And I would say the same thing would be true with your therapist.
Yes.
Even more so. So you have to watch that. And therapists are attuned to that. They'll hopefully talk their way through that, but be alert to that.
So how does one differentiate between non-compulsive masturbation and compulsive masturbation? I hear that we get that question a lot. Masturbation is in my middle circle, which means it's a slippery behavior, but masturbation involving fantasies of my qualifier, the person I cheated with, is in my inner circle, which means it's a bottom line, non-sober behavior. How do I honestly navigate whether a behavior should stay in the middle circle or be moved to the inner circle? Very good question.
Great question. I guess the way I differentiate what you're calling non-compulsive masturbation with compulsive masturbation is kind of the intention, right? I think to me, any kind of addictive sex, masturbation, pornography use is all about kind of dissociating or disconnecting, dropping into fantasy, kind of going off into the bubble or trance and living in that fantasy piece. Healthy masturbation, healthy sex for that matter, I think is not disconnected, but rather the opposite, connected to feelings, connected to sensations, connected to the person you're with or yourself. But just it's a way, it's the opposite of that kind of disconnect where you're dropping into a fantasy and going off into another world, but it's really staying present. And so staying present with your feelings, with the sensations, with pleasure, and that's fine. But I think that you have to kind of check, what am I doing? Am I, did I just have a a fight with my husband or wife and I really have the need to masturbate, because I'm just horny now. Well, no, you're probably, you are dealing with the stress and anxiety of that fight by, masturbating. Everything gets kind of sexualized, as Scott just said. So I think we really have to kind of pay attention to the intention there. And the other thing, I don't know, and I'm curious to hear what Scott has to say with this, but the fantasies with masturbation, to try to make a distinction with inner circle, or I don't know, middle circle, it's so easy to slip from one fantasy to another. I tell my meth clients in recovery, you don't want to reinforce those meth fantasies, even though you're clean and sober. But so they can start out with some healthy fantasy, but those unhealthy fantasies are so deeply grooved, meaning it's so automatic for our brain to go there. We can go there without thinking. And so it's really easy to kind of fall back into that, the place you don't want to be. Yeah, Scott?
Yeah, 100%. I teach the circle plan. I teach it all the time in our work groups. The guys at the house are going to see me on Zoom tomorrow. I'm going to teach the circle plan. And one of the things I always stress is the inner circle or the inner boundary, whatever we want to call it, the bottom line behaviors are behaviors. They're not thoughts, they're behaviors. And you could make an argument that masturbating is a behavior, but it's the thoughts, and you could be masturbating to a perfectly healthy fantasy, and then pop, here comes that unhealthy fantasy. And have you lost your sobriety? I mean, it's a little tough to put those thoughts in there. So, I would suggest that if there's an issue, err on the side of caution for a while and put it all in the inner circle. Just stay away from masturbation for a while, revisit it in 6 months. Nobody ever died from not masturbating. So, you think you can't do it. I know, you're here, you're a sex addict, you're here, you're on this, and you think, oh my God, you're telling me not to have an orgasm for 6 months? Well, yeah, maybe, but it's not going to kill you. It really isn't. And it will give you some clarity and help your brain reset. And it'll also, when those fantasies of your qualifier pop into your head, if you don't reward them in any way, they're going to lose their power. So
Right.
that was a long-winded answer.
That was great. And I do want to just, say this is great that you're trying to really have integrity about what goes where. So I appreciate the thoughtfulness of the question, for sure.
Yeah, absolutely. The fact that you're thinking about it bodes well. So
Yeah.
please help me understand this addict mindset. My husband was very deep in acting out with chemsex for many months, so deep that he moved out and requested a divorce. But when I asked him to see a CSAT, he complied willingly for 6 months. He recently told me the reason he saw the CSAT at my request was that he is a people pleaser and he wanted to please me. Why would he want to please me when he is cheating and lying and wants a divorce? Yes, great question. Is there a good answer, David?
Yeah, I don't know that there's a good answer here, except, addicts do what addicts do. Sometimes I think, including seeing a therapist, just to quiet the water sometimes without really an intention to change behavior. So, chemsex, like all these intensity addictions, it's a really powerful addiction, especially if amphetamines and methamphetamine particularly are involved. So, I mean, there's a great pull and appeal there for somebody. So, but it really takes some willingness to kind of get into recovery. And it sounds like this was kind of a negotiated transactional step that wasn't really motivated by a recovery, but rather maybe trying to just quiet you, frankly, or not have that negative feedback coming at him. So yeah, I think that duplicity, I guess you'd call it, you see between what an addict says and what they do. And it's so easy for an addict, and I'm an addict in recovery, so I kind of know it's so easy to compartmentalize stuff. We can have all this behavior over there, and here we are in the public space and this different presentation, but there's this other life over there, and those two often don't meet. And so I think that's almost second nature to an addict, to kind of, that's not really troublesome to have these different kind of worlds that oftentimes collide. A part of recovery, and it's the reason it's one of the words in our name, the integrity piece is about getting rid of those compartments and kind of bringing everything into daylight and having transparency. And I think that's what was missing in this situation, where both integrity and transparency of like what's really going on here. So yeah.
Yeah, I know your partner's not here to defend himself or herself, well, husband, so defend himself, but I would just start, if I had him in front of me, we would be talking about denial right now, because I just hear so much denial in that kind of blaming someone else. It's denial. And he's protecting his addiction and himself, and it's a natural response. But if he's ever going to recover, he's going to have to break through that, and he's probably going to need help breaking through it. So, is it easier to recover from the betrayal wounds of having a sex addict husband, or is it easier for the addict to recover from their chemsex addiction? Betrayal trauma healing is brutal and seems to be never ending.
Oh,
another question where probably doesn't have a real answer.
Yeah, I don't know that I can answer that, except, both recoveries can be really, really difficult. And yeah, brutal in all caps, and I get it. Yeah, the betrayal trauma, I think people just don't get unless they've been around it or experienced it themselves, in that there's this, the trauma, I'm going to say, of spending your life with someone and then having the rug pulled out from under you and realizing there's this whole other life or other part of this person that you thought you knew, sometimes for years on end. And I mean, the shock and trauma of that, let alone all the betrayal and not just the unknown, but I mean, it's huge. And so I think it's a long process. It, just like the addict drops into denial, I think the partner reflexively starts to wonder, what did I do? What did I do wrong? What's wrong with me? And they need that support and a whole different recovery process. Not that because they've done anything wrong, but because they've been impacted by this experience. And so they're both brutal. I mean, I can't come, it's apples and oranges, but they both take work, they both take commitment, they both take understanding. Usually they both take professional intervention and guidance. And so I think, yeah, I can't say that either is harder or not. They're both pretty hard. I will say, by the way, your last sentence says it seems to be never ending. It does end. It does get better. I know it seems like it's going to go on forever, but those feelings start to lighten. They start to pass. You start to get some new insight. You start to have some recovery of your own self-worth and your self-image, and start to feel really good about yourself. And I have found if you can be patient and work through it, what you come out with on the other end is, I think many people would say, in a much better place than you were when you started, even before the trauma, because you've gained skills. A lot of healing usually takes place. People feel good about themselves, and they most of all, they feel empowered. They have power and to create their safety. If they can't find in a relationship, they can take care of themselves. And so I think there's a lot of beautiful healing that can take place, and it does end. So self-care that we talked about earlier, and patience, I think.
Yeah, I want to reiterate or maybe restate a little bit of what David said. You can heal, and if you do the work, you will heal, regardless of what the addict does. The addict may never heal. That's up to him or her. What your healing is up to you. You can't make the addict get better. Nothing you can do caused the addiction, and nothing you do will fix the addiction. That's up to the addict. But you are in charge of yourself. And you can learn a lot of skills, and you can build your self-esteem. And, you may find that I can live with his addiction within certain bounds, or you may find that you can't. But that's part of your healing process, is knowing where your boundaries are and what you're willing to put up with and what you're not willing to put up with.
And having choice.
Yeah, and then you get to make a healthy choice for you. It may not be an easy choice for you, either direction, stay or go, but it's the healthy choice for you. And I like that you're here finding support. If you have some in-person support in your area, a betrayed partners support group or a therapy group for betrayed partners, something like that, where you can, addiction, being around other addicts is the best way to recover. I think for betrayed partners, sometimes being around other betrayed partners is the most helpful thing. But find betrayed partners who don't automatically judge that you want to stay in your relationship or not. The worst thing for a betrayed partner who wants to stay together and heal, particularly if the addict is working to heal, is to have 6 different people whispering in her ear, leave him, he's horrible, leave him, he cheated on you, why are you still there? Because you feel shame from other people. So you need support that sort of supports what you're looking for in terms of your longer term goals. I feel like I'm just rambling tonight.
No, it was important. And I think just to be aware that we have a lot of partner support groups here at Sex and Relationship Healing too. A lot of webinars.
Yeah. So I would like to know more about letting go of attachment to meaning and labels, especially regarding the meaning of past trauma. For example, the idea that I'm a broken person because of my husband's mental abuse, or the idea that I had to go through abuse to grow as a person, or to label my husband as a narcissist or a porn addict as a way to control my environment. Is there a good meditation to be able to let go?
Well, yeah, great. Another great question. Yeah, so I think one of the things about any kind of abuse or trauma, especially if it occurs early, but really anytime, over time, the person who is being abused or traumatized starts to develop these core beliefs about themselves that are very negative. And they can be, I'm unlovable, I'm unworthy, I'm unsafe, I'm unable to protect myself. No one would understand me if you knew what was going on inside me, and you'd leave me. All these negative conclusions that are a result of the experiences we're having. And as a result of those, we also make behavioral decisions. If I don't feel safe, I may say, well, I'm never going to trust anybody. I'll never be vulnerable. I'll never let anybody near me, that kind of thing. So those are all old things. And by the time we grow up or we get accustomed to them, they're not even conscious. They're kind of, I call them like software. They're operating like an operating system in the background, informing what we do, but we're not even conscious of them sometimes. So again, I think therapy is really helpful to kind of dig down a little bit, whether it's trauma therapy. I do hypnotherapy for this too, where people just kind of relax, go deep, and find out what those core beliefs are and really actively change them. So I think you talk about meditations for this. I think affirmations are a wonderful way to do this, to really figure out what those negative core beliefs are that you carry about yourself, and figure out what was the antidote to that. What's a statement, an aspirational statement, but you write it in the present tense, right? So I am strong, I can choose, I can protect myself, I am a wonderful, lovable person, whatever it is that fits for you, and to really start to incorporate those manifestations and affirmations into your life. In terms of meditations, I really just like, without getting too much into the weeds here, there's a process by Carl Jung called active imagination. But basically, and this is just an idea, to get really quiet in your meditation and have a dialogue. Have a dialogue with the wounded part of yourself, with the little girl part of yourself, and sort of, you can do some healing of yourself too by bringing in your adult wise self and kind of talking to that little girl, little boy that we carry within us that's kind of wounded and believes these things about him or herself. So that's a way to do it with meditation. But I think affirmations are the really powerful antidote for that.
Yeah, yeah, there are days where we all feel broken, and those are not fun days. So yeah, glad you're here. Okay, what is EMDR?
Sorry about that. I got jargonish. So EMDR is eye movement desensitization reprocessing, and that's a really horrible name, but it's a really cool therapy. And what it is, it was discovered by accident by a woman named Francine Shapiro, who was kind of in a troubled state, walking on a beach or a lakeside and looking from left to right, and she discovered that if she would start to feel better, started to have some resolution of some of the thoughts and memories that were troubling her. And out of that, she was a psychologist. Out of that, she developed this program that was called eye movement, EMDR. And the idea of EMDR is that in trauma, when trauma occurs, the parts that should be normally processed by our brain and kind of filed away in different parts of our brain, that get stuck. And so by increasing what's called bilateral stimulation, which is the two halves of the brain talking to each other through the corpus callosum here, we can start to heal. And the brain knows how to heal from this trauma. It just doesn't have like the capability to do it. And by starting to do this bilateral stimulation, the brain gets more kind of open to that resolution of that. And so what they've done is combine guidance from a therapy along a protocol, and you drop into EMDR. There's this bilateral stimulation, and I can't describe it. I've done it both as a therapist, I do it, and as a client, and it's quite profound because you just start to feel better after quite quickly. What they do, they no longer, well, they do sometimes do the eye movement, and basically the bilateral stimulation is looking left, right, left, right. And for a while they had light bars that would do this like running light back and forth. There's little vibrating, little things you hold in your palm that alternate speed, vibrating left, right, left, right. You can also do it just by tapping. I noticed one of our clients tapping yesterday or today. It's a wonderful skill where if you tap left, right, you can do it in a meeting. Nobody notices what you're doing. Sometimes kids who don't have the patience to sit with traditional EMDR will do tapping with kids because they can do that. And it starts that bilateral stimulation as well. I might say tapping also, by the way, is a fabulous technique where there are basically different protocols for different conditions that utilize pressure points, the same pressure points as acupuncture. And by tapping on certain points, you can do a lot to kind of alleviate stress and things like that. It's a whole specialized skill to do that. But EMDR is a really wonderful technique, but it's this idea of bilateral stimulation and being guided with a therapist through a kind of a healing protocol. And it's really, really effective.
Yeah, I wish I was smart enough to understand why those techniques work, but all I really need to know is they work, and they work really well.
And even places like the VA approves EMDR. I mean, it's recognized as working, but we still can't quite explain why.
Yeah. Maybe someday we'll know enough about the brain to know exactly why, but for now.
Right.
My betrayed partner gets upset at me that I do not see the therapist every week like she does. You said the therapist, so I wonder if there's only one between you. That's a thought. She told me I need a coach to go over my sex/porn addiction. I attend meetings 3 times a week and 12-step. My therapist only meets me once a month. She gave me the coach information in getting these books, which she shares with her therapist. I feel a bit overwhelmed and would suggest that I need to go to treatment for 2 weeks, but I know I cannot miss work and my job during the time of COVID. She repeatedly asked questions over and over again. She wanted to take my smartwatch and phone for the weekend and give me a substitute phone. I drew my line there. My watch was made for health and not for messaging or calling. She wants my phone to see who messages me. However, my phone has been used for personal and work. And then she reads messages from work dealing with FERPA and HIPAA issues, which are privacy issues. I want to delete these messages, but then I feel a lose-lose because then she thinks I'm hiding items. I just feel, this continues, I just feel frustrated because I want to go buy a car and she does not want me to buy a vehicle by myself because I might hit on a woman on the road, but I want to get the car back. I am just living. Okay, so we've got a wife who's really involved in the husband's recovery, and he's having enough of it. Is this common, David?
Yeah, of course it's common. We talked earlier about the effect of a betrayed partner, right? Where the rug gets pulled out from under them and their world kind of falls apart, and the person they thought they knew there's more to this person they didn't even know about. And so one of the very, very common reactions to that is to like become a detective, to that. And this is an anxiety response. I need to find out if I know more, then my anxiety will be alleviated. I'll know more. And the problem with that strategy is that there's never enough. And this is not true just with partners, but it's true of any kind of anxiety disorder where people are seeking for just enough information to get me through the anxiety, because there's always that little shadow of doubt and the need to pursue information about that. And so we do see this very often where partners become detectives, looking at phones and tracking devices and you name it. So I think it does happen. I understand it. I understand the motivation for it. I think it's not a very helpful strategy for either person, because ultimately the healing that has to take place involves trust and integrity and transparency. And um, what I've seen is mostly it just takes time, and really the person working their program and showing it by word and by deed and time. So I think, I do understand the strategy to kind of get more information and control and sit in on meetings and do whatever. But I think you start to get the reaction like the person writing this, where the people are frustrated and upset and feels kind of watched, and that it introduces a whole other dynamic. Now that said, I also think you should probably be seeing a therapist more than once a month, because that's really critical here. You need to be seeing a therapist once a week, especially in early recovery.
And preferably a certified sex addiction therapist, if that's
Yes,
not one now.
It's just not enough. Once a month is just not enough, especially in the beginning. Maybe with time you can kind of space it out, but we really need that support, especially early on. And I think, by the way, 2 weeks might be a good idea for you sometime to really get away from all the interference in your life and get a really strong foundation. But what happens, and this is a common dynamic, not just with addiction, but with couples, where one becomes kind of the pursuer. In couples dynamics, sometimes they talk about, the turtle's shell, right? And you get the person, banging on the shell, come out, and the more they bang, the more the person withdraws, and it's a lose-lose dynamic after a while. So I'd suggest some guidance from a therapist on some boundaries and some practical strategies to manage your recovery and her recovery, frankly. But I think you really need to up your game with the therapist.
Yeah, and maybe a couples therapist to help the two of you set some boundaries, and preferably, again, a CSAT who does couples work, because certified sex addiction therapists understand this disorder in a way that most other therapists just don't. And this is a very specific issue with very specific forms of denial and sort of attempts at control by both sides. And you need somebody who really understands this and has some experience to deal with it, or this is just going to be, you use the term lose-lose, David used the term lose-lose, and yeah, that's what it's going to be. If you can't work out some useful boundaries that work for you both, because she wants to feel safe and you want to feel like I'm recovering for me and I need to do it, the way that my therapist and my, but yes, see a therapist more than once a month. That's not enough. Okay, do you believe in trauma bonding? Does it generally start in childhood and then we relive it due to the familiarity? So maybe explain what trauma bonding is and then go from there.
Yeah, so trauma bonding is when we have a traumatic experience, we learn kind of how to create a relationship with that person, oftentimes as a caregiver, a parent, or some other important person in our life that can be abusive or is abusive, and that we kind of learn that relational style with that person. And sometimes it's to survive, sometimes it's to get love, but it's a kind of a dysfunctional way of attaching to a certain kind of person that kind of recreates some of that trauma that we experienced early on. And so that does tend to play out in life. I've had clients who were in really bad relationships. I think that were some trauma bonding, whereas maybe getting involved with an abuser, and we work really hard in therapy to get them out of that relationship. And a year later, they're back, same relationship, but a different person. This does kind of tend to repeat over time, unless people kind of heal that original kind of bond of a dysfunctional bond, if you will, of someone who's like the abuser, if not an abuser themselves. So there's that kind of trauma bonding that can occur. And I think, I'm not sure if it's so much familiarity, but that probably is a part of it, but I think it's really an attachment style that people learn, and it's it goes deeper than just familiarity, I think, in terms of just these deeper beliefs about who I am, how I connect, where my worth is, that kind of thing. So yeah, I think it does play out. And it can be resolved, but it probably takes therapy again to resolve it.
We could probably spend a whole hour on that topic. So I'm going to skip the next question for just a second because we got to follow up to the previous question. What happens if my therapist does not want to meet me once a week?
I think you need to find a new therapist.
Thank you. Okay.
I would wonder why, but
if your therapist can't meet your needs, you need a new therapist.
Yeah, I'm sorry. I think that's just kind of weird. I think, or certainly you deserve an explanation of why, but I mean, I think, I don't know you or your case particularly, but in general terms, I think probably weekly therapy is a good idea. At least
weekly therapy is kind of standard.
Kind of standard, yeah. So I'm not sure what's going on.
Yeah.
Now, I think you referred to the therapist, right? So if you and your wife are sharing the same therapist, I think that's not a good idea. I think you each need your own therapist. You each need your own advocate who can handle that. So I don't know if that's a factor here or not, but I really strongly recommend not having the same therapist for husband and wife.
Okay, so let's take this as our last one here. When chemsex addicts stop therapy and 12-step meetings and feel they can manage it on their own, is this denial, and are they probably going to relapse?
Yes.
Yeah, totally.
I'm sorry. Yeah, I mean, an addict, especially a chemsex addict, because it's such an intense addiction. We need maintenance therapy the rest of our lives. We need 12-step program. I need a support program. I'm never going to graduate from my program. I might go less than I used to. I would, 2 and 3 meetings a day in the beginning, but you don't outgrow it. You don't graduate. And I think when I see that, I really worry because that's all about denial. I do not know anybody, frankly, who has done well at all with that kind of strategy. It just doesn't work. There's too many triggers. So I'd be very worried about that person.
Yeah, there is no cure for addiction. Addiction is like diabetes. It is a permanent lifestyle change that we have to make. And it's daily, shots for insulin and daily change in diet. And, addiction is the same way. It needs daily maintenance to stay sober. And just to point out, chemsex, it's 2 addictions fused into one. So any kind of a drug trigger is going to trigger desire for sex too. Any kind of a sex trigger is going to trigger the desire for substance abuse. It's double trouble with triggers. There's twice as many triggers to deal with.
Right.
So, it's twice as important to stay actively in recovery on a daily basis. I don't go to a meeting every day, but I do something for my recovery every day because I have to, or I won't stay sober.
And we've been talking about denial tonight, but that you say that belief that they can manage it on their own, that right there is trouble. That's like the definition of denial, probably.
If we could manage it on our own, we would. We wouldn't be here if we could manage it on our own. We would never go to our first 12-step meeting if we could manage it on our own, because if we could manage it on our own, we don't have a problem. Addicts have a problem. So, okay, we're out of time, everybody. We got a couple questions left. Save them for next week. We will be back. Thank you, David. Remember, David talked about self-care, stay mindful, connection, find balance, take time for self, and set some healthy boundaries. Anything else you want to add, David?
Just that. Easy to say, harder to do, but we need to just do it.
Okay. Yeah. Thanks, everybody. We will see you same time, same place next week. Have a good evening.
Good night.